the urgent need for more orderlies in Quebec's long-term care homes due to the COVID-19 pandemic and the aging population. One of the most pressing challenges facing Quebec's healthcare system is the shortage of orderlies, or préposés aux bénéficiaires, PABs, who provide essential care to the elderly and vulnerable residents of long-term care homes, known as CHSLDs, and seniors' residences. The COVID-19 pandemic has exposed and exacerbated this problem, as many orderlies have fallen ill, quit, or retired due to the stressful and risky working conditions. At the same time, the demand for their services has increased as the population ages and more people require long-term care. According to Quebec Health Minister Christian Dubé, the province is currently missing 11,000 orderlies, but that number could double in a few years if nothing is done to address the situation. This could have serious consequences for the quality and safety of care provided to the residents of CHSLDs and seniors' residences, who are among the most vulnerable to COVID-19 and other health complications. In fact, more than 80% of Quebec's COVID-19 deaths have occurred in these facilities. To tackle this challenge, Quebec has launched several initiatives to recruit and train more orderlies in a short period of time. In 2020, at the height of the first wave of the pandemic, the province hired 10,000 new orderlies through a paid training program that promised a full-time job and a salary of $49,000 a year. Although some of them have left their positions since then, about 8,000 of them are still working in the healthcare system. The province also relied on hundreds of asylum seekers who had previous experience as orderlies in their home countries to fill the gaps in staffing. However, these measures were not enough to meet the growing demand for orderlies. In May 2023, Quebec announced a new plan to recruit another 3,000 to 5,000 orderlies by the end of the year. Applicants will be eligible for an $8,000 bursary to take an accelerated training course that will last 375 hours over 3 months. After graduation, they will receive an additional $4,000 bonus and a guaranteed position in a CHSLD or a seniors residence. The province hopes to attract young and retired workers who are looking for a rewarding and stable career in the healthcare sector. The recruitment of more orderlies is crucial for improving the living conditions and well-being of the residents of CHSLDs and seniors residences who deserve dignity and respect. It is also important for reducing the workload and stress of the existing orderlies who have been working tirelessly and courageously during the pandemic. By investing in more human resources for long-term care, Quebec is crafting a new precedent for orderly recruitment that could inspire other provinces and countries facing similar challenges. Quebec is facing a severe shortage of workers in various sectors, especially in healthcare and education. To address this challenge, the Quebec government has launched several initiatives to attract and retain new recruits, offering them generous incentives and support. One of these initiatives is aimed at hiring more orderlies, who are essential staff in long-term care homes and seniors' residences. Orderlies are responsible for providing basic care and assistance to elderly or disabled people who need help with their daily activities. They also ensure a safe and comfortable environment for the residents and contribute to their well-being and quality of life. Orderlies work under the supervision of nurses or other health professionals. To become an orderly in Quebec, one needs to complete a 3-month training program that covers topics such as hygiene, infection prevention, nutrition, mobility, communication, and ethics. The training program is offered by several CEGEPs, colleges, across the province, and it leads to the recognition of skills and clinical experience by the Quebec's Order of Nurses, OIQ. The Quebec government has announced a recruitment blitz to hire 3,000 to 5,000 new orderlies by 2023. To encourage people to apply for the training program, The government is offering an $8,000 bursary to cover the tuition fees and living expenses. In addition, graduates will receive a $4,000 bonus and a guaranteed position as an orderly in one of the targeted regions where the need is most acute. These regions are Abitibi-Témiscamingue, Côte-Nord, Bas-Saint Laurent, Gaspésie, Saguenay-Lac-Saint-Jean, Baie-James, and the Outaouais. The starting salary for an orderly in Quebec is $49,000 a year, which is higher than the national average of $43,000. Orderlies also enjoy benefits such as paid vacations, sick leave, pension plan, and insurance. Moreover, orderlies have the opportunity to make a positive difference in the lives of vulnerable people who depend on their care and compassion. The Quebec government hopes that this initiative will help fill the gap of 11,000 orderlies that currently exists in the province's healthcare system. The demand for orderlies is expected to increase in the coming years as the population ages and more long-term care facilities are opened. By offering attractive incentives and support to new recruits, Quebec is crafting a new precedent for orderly recruitment that could inspire other provinces and countries facing similar challenges.